Okay, welcome back to Deuk Spine, and we are live streaming a patient who travels here who's had fusion at L45, L5S1, artificial disc at L34. He has sacroiliac joint pain. Jordan, show us the SI joint. Okay, Jordan's going to trace it with a white arrow. That's the bottom coming up. Look how arthritic it is. It's got all that sclerosis, which is darkening of the bone there. That's because the bones are rubbing on each other, causing pain. Now, Henry, show us a video. You can see the tip of my probe. I'm making my first burn right there. That's going to be the L5 dorsal ramus, and that's the first nerve that goes to the joint. So I will be burning these nerves with my probe all along the joint as you guys watch our video animation showing you why do SI joints hurt and how we fix it at Deuk Spine. It's different than what everybody else does. Keeps forcing me medial. Welcome back. So I am right now basically destroying 5 pain nerves to the SI joint. All right, they run, see the tip of the probe?
Yes, we do.
There's a little hole right there in the bone, yep, and the nerve comes out of that hole and runs laterally to the SI joint. My job is to destroy that nerve. Other doctors use radiofrequency ablation. It doesn't work and certainly doesn't last. Shot. We've learned to do it a different way using a probe, and the probe I use, we call it the Deuk Plasma 1, delivers more energy, and more importantly, we can wand it and move it so that we can try to get all the pain nerves along the back of the sacrum. Yep, we need to change the probe. Let me have pressure here. I'll take over. Any questions?
Yes, we have a couple questions. This first one coming from LQ on
Sean?
Twitter.
LQ, welcome. I'm going to put a second incision.
Asking, would a painless collapsed disc cause stiffness, rotation issues, etc., especially if bone on bone?
A painful collapsed disc will never cause any symptoms at all from bone on bone. What causes the symptoms is how are we doing, Dr. B? Good? So I just got the 2 SI joints, probably 10, 15 minutes max. What causes your symptoms is not bone on bone. It's the inflammation happening in the tear in the back of the disc. I know that people are led to believe it's bone on bone. That's misinformation. It's not AI-generated misinformation. It's human-generated misinformation. And honestly, I used to believe the same thing as a neurosurgeon. I was taught that. But the truth is, the God's honest truth is that bone on bone does not cause pain or any symptoms. And how do I know that? It's real simple. There are millions of people with bone on bone at many discs in their back, millions, and they have 0 symptoms, right? I'm serious. They did a study in Japan. They took 1,000 people off the street that had 0 pain in their back or neck. They got MRIs of their back and neck. And guess what they saw? 900 patients. 90% of those patients had bone on bone, degenerated disc, herniated disc, but they had no pain, right? No symptoms. So what that taught us, and this was years ago, what that taught us, if you're paying attention, is that these structural changes do not equal symptoms. Okay, so that's why, one of the reasons why back pain has mystified doctors for so many years is you cannot look at structural changes to make a diagnosis. I would say a little lower here maybe. Let's see, shot. Yeah. He has got a really medially projecting wing of his ilium. I'm going to have to go more medial. Maybe here. Let's see what we got here. Shot? Uh-huh. Right? Jordan, are you seeing what I'm seeing? A very medial projected wing? All right, that's it. Yeah, I think right there. Shot? All right, good. So to answer your question, I would say right there. Let's go ahead and make our incision. We're going to treat the right SI joint, right in the middle. Yep. The nice thing is you make an incision, you can actually pull the skin a little bit, left and right, up and down, to kind of get a better entry point, so to speak, because your target is deep. Your target is the nerves running along the back of the sacrum. These are pain nerves, sensory nerves. You showed the video, right?
Yes.
Yeah. And our goal here is to destroy those pain nerves so they never work again. That's called a rhizotomy. Shot? Now, rhizotomies are typically done by most doctors using a system that doesn't work. Why? Because that's the system they were trained on, and that's the system that's provided to them by the industry. This is part of the problem. We trust the industry. Doctors are trusting the industry that we shouldn't be trusting. This industry is not devoted to patients getting better. The industry is devoted to profits. And unfortunately, making profits is hurt by people who are cured of pain, right? And same thing with cancer. If you cure somebody of cancer, you can't make any more money on them. That's how this industry thinks. So doctors are trusting the industry now to lead them in their treatments. And that is one of the biggest mistakes we're making in medicine. So I agree that fixing the healthcare system requires that we get doctors and patients making decisions together. But I also believe patients need to be empowered with truth, the information, information they need to make the right decisions for themselves. And there should be, honestly, guidelines that are not written by insurance companies or by the industry guiding people. And we don't have that right now. Okay? And this is not just spine I'm talking about. This is also everything in medicine. Everything in medicine has been corrupted now by the industry, by the companies that are profiting. These companies are the same companies that are hiring lobbyists in DC and in states legislature. They're buying off politicians. They're placing politicians so that those politicians will write laws that benefit them. Okay? That's what's happening. And we've got to stop that. We've got to get rid of the special interest groups out of healthcare, and we got to put the patient back. 30 seconds. Put the patient back at the heart of healthcare. It is the patient. That's why we do medicine, to get people well. The best, safest, most effective treatment that lasts the longest. So we want safety, we want effectiveness, we want durability, and we want quick recovery. That's what we need for people. All right, I'm done with the SI joints. Are there any other questions?
At this moment, no current questions.
Well, thank you for joining us. I apologize for the multiple live streams, putting a little bit of medicine because I burned a lot down there. And you can see the incisions are tiny, 4 millimeters. I actually had to make 2 on the left side because I wasn't happy with the first one. Like, I got 2 of the nerves, but I couldn't get the other 3. So I had to go down lower. Let's put pressure. And any other questions from the audience? We'll be back shortly with another surgery. The next surgery will be, actually, we're going to do a piriformis release in the other room, right?
Yes, sir.
So we're going to do the bilateral piriformis release in room 2. You won't see that. And then, yeah, we're fine. It's in the wound, but the other one's good. And then we're going to come back here with a Deuk laser disc repair. All right, Luis is We're removing a badly placed staple on my part. Thank you. Any other questions before we end?
No current questions.
All right, thanks for joining us at Deuk Spine. You've watched a bilateral sacroiliac joint Deuk plasma rhizotomy where we basically kill 5 pain nerves to the SI joint to treat pain from the SI joint. It's the most effective treatment in the world. The fusions of the SI joint don't work. That's been proven by a study out of Norway just this last year, and I don't recommend it. All right, thanks for joining us. Have a nice day.
Sacroiliac joint injury is a common cause of chronic back pain. The inflamed sacroiliac capsule tear generates pain signals. The best treatment for sacroiliac joint pain is the Deuk plasma rhizotomy. Sacroiliac joint pain nerves are destroyed. The advantages with the Deuk plasma rhizotomy is that it's an outpatient procedure that takes 30 minutes to complete, very minimal bleeding and pain after the surgery with immediate recovery and return to work the next day, as well as a 99% success rate and permanent pain relief with a single treatment. For more details, please visit our website at www.deukspine.com.